Dr. Giordano, what type of opioid combative programs do you see this money going towards?
Well, I had the good fortune to, I still have the good fortune to be sitting on the State Opioid Settlement Board. And the counties are being asked to look to the board to kind of prioritize this money. And one of the things that we identified at the state level, which I think is a good start in answering your question, is to look at the first year or two as almost like rescue funds, to try to get as much life-saving, direct care projects out on the street, and to include things like flooding Narcan wherever it might be needed, working with local emergency services to make sure that everyone has that. Beyond the life-saving part is prevention, education, treatment, all of the pieces that go, that, we have a rich system in Albany County that many of you have heard me talk about, rich in terms of many services, but it's only the tip of the iceberg. So, what I would hope to see is that we're able to duplicate the programs that are working and to increase the presence throughout the county. I think prevention education is going to be a long-term goal for us. But again, working, this has from the beginning been a partnership between health and mental health, and I think both of our departments are currently involved in a number of projects that we'd like to see continue.
Are legal injection sites talked about? Are they on the radar?
They are talked about. Would you like
Can
to
you
tell us?
elaborate on that?
Well, so here's the thing, and this is like the third rail. This is, you touch this and it's at the state level, the board of 21 members from across the state, we recommended that OASIS and the governor's office consider safe injection sites after hearing testimony and hearings from people from all over the state. We made 200 recommendations at the state level. 2 were rejected. That was one of them. And it was rejected because it is federally not legal, apparently. Problem is that, and what is still a curious, I think, observation, is that New York City is running 2 of them, and the mayor wants to do 5 more, and I'm not sure if it's illegal how they're doing that. So there is interest, I think, across the state. I have been part of some discussions locally about what the implications would be for that. I know of no plans to push that forward, though. I think that's going to be a multi-pronged kind of thing.